of the scapula and the medial border.
어깨뼈 가시랑 안쪽면 먼저 찾고요.
And to find this point, trinonum scapulae, here runs angulus superior, here runs the scapula, the medial border, and then we have here the spine. And for us, this point is very important to find, trigonum spinae, because the fibers of the lower trapezius runs here and here on the lower border of the spine of the scapula, and from here on it goes in the middle trapezius. So please take this reference point first. Okay, and then you know there is the T12 in this region, and then you know the muscle must run in this direction, and the muscle, it comes over the middle border of the scapula, and here you can reach it best. So you have to be very clear about the topographical situation. And then you have to perform this movement. Now the picture isn't correct anymore because I move, but you know where to start, and then you go a little bit lower of the border you think the muscle can be, and if you move like this, you go a little bit backward, forward, down, up, and then it's perfect how it performs. That is very released. Then you try to get here the muscle, and here it's very difficult for me to find it. I will show after with another person, but I can feel it here. It makes plop, 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 but it's very tough, and it's not possible to take the muscle away. Sometimes you can take it away. I will show it after, but I can clearly know here is the border of the muscle. If I see I can't take it away, it doesn't make sense to insist and to stay like this, then I change. And it's no problem if I can take it away. It's comfortable, because when I can take it away, I know I have just this superficial layer muscle, this trapezius, in my fingers, and then the diagnosis is clear. When I can't pick it like this, then I go in opposite. I go in a little pre-stretched situation, so I can feel the fibers very well. But when I press now, it's not so clear where is the source of the pain, because I have a pressure on the trapezius, on the rhomboids, if I'm here, or to the erector spinae if I'm in this region. Then I have not so clear the information. Okay, so first you try to take it like this. If it works, it's good. If not, it's no problem. Then you go in this position and you're looking, okay, can you take contact with these fibers here, and now I'm on the muscle. Here you can see it makes blong, 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 blong. And it's easy. The fibers of the trapezius runs like this. The fibers of the erector trunci runs like this, and the fibers of the rhomboids runs like this. So there is a clear information. You are correct on the superficial layer. Okay, so this is first thing. Then on your front side, please.
그리고 일단은 여기 그 토리움 스파이나라는 지역을 먼저 찾는 게 중요한데, 그때 이제 슈페리어 앵글과 그다음에 이 메디얼 보더를 활용을 해서, 그리고 스파인까지 활용해서 이 세 개 지점이 만나는 부분을 먼저 찾으시고요. 거기서 우리가 아까 사이드 상태에서 만졌을 때 T12 부분에서 이어지는 로어 트라페지우스를 그냥 만질 수도 있고 떼낼 수도 있습니다만은 그게 때때로 불가능한 경우도 있습니다. 사람에 따라서. 그때는 사이드 라인에서 요렇게 반대쪽으로 스트레칭 자세를 취했죠. 그렇게 함으로써 텐션을 더 증가시켜 가지고 요 부분에서 퉁퉁거리는 것을 느낄 수가 있고, 그리고 팔페이션 테스트에서 우리가 근육 결을 알고 있으면은 로어 트랩을 구분하기가 쉬운데 이제 기립근 같은 경우에는 결이 요렇고 lumboid 같은 경우에는 또 요렇고 어퍼 트랩은 로어 트랩은 이렇기 때문에 이제 결을 생각하면서 하면은 좀 더 명확하게 구분을 할 수 있다고 했습니다.
Then in front position, please both arms like this, just a moment, and lift both arms, hands also. And in this task, you can feel the muscle very well and down. Now it's not so clear, and up again. And then you can feel the border of the muscle very well, and so you are informed and down. Where the muscle lies, you are looking for taut bands, you are now looking for hot spots, and you're looking for pain recognition. You can put the arms like this, or you can turn if you have found the muscle. No, just like this. Okay. And then you can treat it. If it's too much, you say stop. Okay. So this is first layer with this fiber direction. Now we go to the rhomboids. The rhomboids, other color, they runs from C6, C7, this is here, and it runs also to this point. This is very comfortable, so I know the direction of the rhomboids. It's very clear. This is rhomboideus minor. And the major rhomboid, he goes then to the inferior angle, and it's parallel that you see. It's a very, very big muscle too. So this is fiber direction of rhomboids. So my palpation direction now changes. I have to go perpendicular to the fibers of the rhomboids. Most easiest way is to start here in this region, because here often you can find the muscle fibers directly here.
저 공간이 다른 섬유 그 부분에 비해서 좀 열려 있는 공간이어서 저기서부터 팔페이션 하는 게 좀 쉬운 방법이라고 합니다.
Okay. And if you feel here fibers which is plopping, it's not possible that this is the trapezius. Why?
여기서는 이제 블록블록 거리는 게 촉치가 가능합니다만은 여기서는 이제 촉치하기가 어려운데 이유에 대해서 밑에 축이
Exactly, because of the fiber direction. I run now parallel to the trapezius, and so it can make plop plop. So if it makes plop plop, it has to be the second layer of the muscles. It has to be rhomboids. Exactly.
네, 두 가지 이유에 대해서 말씀을 해주셨습니다. 두 번째 층에 있는 그 덮여 있는 이 때문에 하나의 이유고, 이제 다른 이유는 여기서 블록블록 거리는 거를 느낄 수가 있고, 이 어퍼 트라페지우스 같은 경우에는 여기를 지나가기 때문에 여기를 이렇게 만졌을 때 어퍼 트랩의 결을 느낄 수도 있지만은 어퍼 트랩의 결이라고 그게 배제될 수가 있는 이유가 방금 요렇게 팔페이션을 했죠. 근육결의 롬보이드의 근육결의 수직으로, 그래서 롬보이드는 만질 수가 있는데 결이 볼록볼록하게 느껴지는데, 로어 트랩 같은 경우는 결이 이렇게 되니까 우리가 이렇게 결 따라서 만지고 있으면은 로어 트랩에서의 볼록볼록거리면은 조금 배제시킬 수가 있다는 겁니다.
Okay. And then if you feel the taut bands, you follow the taut bands. You are looking for the spot tenderness, and then you can treat it. This is simple. Now to the third one. We have the serratus posterior superior. He runs here at the same direction, but up to T2. T7, 1, 2. So it's just in this part to the ribs, not to the middle border. He goes to the ribs, but it follows. He lies in this area.
요 오리진 같은 경우에 위쪽 섬유에 대해서는 같이 척추 삼각으로 가는 게 맞고, 아래쪽 섬유의 경계선은 이렇게 갑니다. 근데 이제 아까 설명했죠. 스캐폴라 어깨까지 가는 게 아니고 립에서 끝나는 머슬이라는 거.
And so we have to be aware that the shoulder is maximal in lateral position.
최대한 가쪽으로 스캐폴라 당겨놓고 시행을 합니다.
So I palpate here the angulus costae. Please translation, I go. You see the rib forms here a characteristic an angle, angulus costae, and the muscle runs from C6, C7, T1, 2 to here to the outer side of this rib angle, because between the rib angle and here will run the erector trunci, and the serratus posterior superior lays over the erector trunci and spans the erector trunci to the spine. So we have to palpate this rib angle and to feel its scapula enough laterally that you can feel this rib angle, and then you are correct. And if you can't feel the rib angle, you have to go further with the scapula by side. So I palpate the rib angle here, I can feel it very well, and then I follow this rib angle and I feel, okay, here is the rib angle and the border of the scapula is here, so it's perfect. If this wouldn't be, I have to change. I have to put the chair here and to say, okay, please come a little bit laterally.
가쪽으로 쭉 팔을.
Perfect. And then you can put the shoulder here, and you see the shoulder goes more laterally, and then you can feel easier the rib angle, and you have enough space to treat and to find this insertion site. Because most trigger points in serratus posterior superior are in this area where often the muscle is covered by the scapula.
네, 저기 또 나와 있고 이게 갈비 모서리가 갈비 모서리가 요 지점 부분에 있습니다. 근데 요 지점을 따라가다 보면은 팔이 만약에 이렇게 되어 있을 때는 스캐폴라에 가려져 있지만은 이렇게 펼침으로써 공간이 나오게 되고, 그리고 이 과정 이렇게 포스를 취하는 게 굉장히 필수적인 게 대부분의 세라투스 포스terior superior에서 트리거 포인트는 요 인서션 위치에 있기 때문에 이렇게 드러내는 게 치료의 필수라고 합니다.
And you see the problem we have now, both muscles, the rhomboids and the serratus posterior runs the same way, and I don't have any possibility to differentiate.
결이 완전히 같고 방향도 위치도 같기 때문에 팔페이션을 구분하는 게 거의 불가능합니다.
Okay, I have to accept this situation and to do my best, and I will start with provoking.
네, 그래서 구분하는 데 있어서 할 수 있는 최선의 방법은
I know where the muscle
자극입니다.
must run, and then I perform this provocation. It's okay?
Okay.
1, 2, 3. It's equal? 3 is more. Here. Okay. And if you can reproduce the pain the patient is familiar with, then you can treat it. And for treating, you say stop, please, if it's too much. It's okay? It remains local?
터지나요 아니면
그대로
로컬?
Local. Okay. If there is a local pain, and this pain is the pain the patient is familiar with, we have an active trigger point, and then we don't know from which muscle does it rise. It could be middle trapezius, it could be a rhomboid, it could be serratus posterior superior. But when I press here and the pain goes to the elbow and the arm, then I think it's the serratus posterior superior. Okay. For treatment, please take a wound.
나무 툴을 쓸 거고 여기서 우리가 지금 여기서 통계가 유발됐지만은 이게 우리가 방금 언급한 세 개의 근육층에서 어떤 건지 알 수가 없습니다만은 이 만약에 로컬하지 않고 리퍼드 페인이 나타나는데 팔꿈치 쪽으로 간다 그러면은 우리가 세라투스 포스테리어 수페리어라고 생각을 해볼 수가 있습니다.
I make the diagnosis with my fingers, but for treating, it's more comfortable to do like this. It's okay? It's okay. Which technique?
어떤 기법이죠?
2A.
Yes, exactly. It's the same. Yeah. You see, slowly, with firm pressure. And my fingers are very released. Okay. Or I make it like this. Technique.
3번 이렇게 적용.
Both for rhomboids and for serratus posterior superior.
롬보이드에 대해서 적용될 수도 있고 세라투스 머슬에 대해서도 같이 할 수도 있고.
Okay. This first success I'd like to show you in lateral position. May I use you, please?
모델로.
Model, as model, yeah. Because I think I can show how to take away the muscle. Thank you so much.
아까